Okay, everyone, we are up to topic 8, part 4, hey? Very exciting. So this part has a lot to it, but I'll try to make it as simple as I possibly can for you. Okay, so what we need to understand is that cells need access to blood. So blood needs to be able to flow through the capillary bed at the correct rate. If cells don't have blood, they will die. So blood flow is very important in order to make sure that we keep the tissue perfused. So blood flow is important to make sure that we keep those cells having access to the blood that they need. So what is blood flow and what is perfusion? So blood flow is how much is going through an organ. This is a time factor. Whereas perfusion is the flow per mass of tissue. So flow is just how much is going through, whereas perfusion is actually a more specific and correct measure because it's how much blood is going through the tissue. So we want to make sure that all cells in the tissue get the blood that they need. So perfusion is very important. All tissues must be correctly perfused, and perfusion depends on blood flow. Okay? So blood flow depends on two things. The first thing is the difference in pressure between 2 points, and the other factor is peripheral resistance. So what do I mean here? If I have lots and lots of blood in one area and not a lot of blood in the other area, which way is the blood going to move? This way. If I had lots and lots of blood here and lots of blood here, there's no pressure difference. So blood is not going to move. So you only get blood flow, when there's a pressure difference. No pressure difference, no flow. All right, let's spend just a little bit of time thinking about how pressure is measured. Just a little bit of history and physics just to spice it up a bit. So there was a guy long time ago, and he wanted to measure the weight of air. Okay? So he came up with this thing, which is a barometer, which essentially is putting mercury in a bowl and then putting a tube into that bowl. So if you have a look here, the grey stuff is mercury. Now, I don't know how he came up with it. All I know is that he worked out that if you have this mercury in a bowl kind of device, what happens is that the weight of the air in the atmosphere pushes down on the mercury that's in the bowl and causes the mercury to go up the tube 760 millimeters. That's the height that the mercury goes up. So, if you have more air pressure, the higher the mercury goes up the tube. If you have less air pressure, the less the mercury goes down the tube. So this actually became, this number, 760 millimeters, is the number that we refer to as atmospheric pressure. So it's at sea level. That's what we're talking about. At sea level, the air pushes down on the mercury, so it goes up the tube 760 millimeters. So that millimeters of mercury is what you use as units for measuring pressure. And it all stems from this guy's contraption. Okay? So when you measure systolic blood pressure, the number, say 120, means 120 millimeters of mercury above the 760 that we already had. Okay? And diastolic blood pressure, that number means 80 millimeters of mercury above what we already had to begin with. So just a little bit of history on what this unit means and how it came about. Okay, so now that we know what pressure is, we can think about what blood pressure is. So what is blood pressure? So blood pressure is how the blood pushes against the blood vessel wall. That is what blood pressure is. That's the definition. And we have two values, like I've said to you there. So we measure blood pressure with this device that uses millimeters of mercury as their unit. So you know what that unit means now. And you're going to have lots and lots of practice in measuring blood pressure. So you probably know this already. What you do is that you pump up the cuff to make sure that the artery is completely occluded. So it stops the blood flow and you can't hear anything. Then we release the cuff and we start listening for the sound. Okay? So these sounds are created by the blood flowing through the blood vessel. So you first of all shut the artery, then you listen to when the sound starts, and then you listen to when the sound finishes. So when the sound starts, gives you the systolic blood pressure, and when the sound finishes, gives you the diastolic blood pressure. So that's how we measure blood pressure. A couple of other things that you may need to kind of think about when you're a nurse is what pulse pressure is. So that just is the difference between the two pressures there. The other one is mean arterial pressure. That one is really important because it's a measure of perfusion. You have to have a level of pressure in order to make sure that blood is going to where it needs to go. If the blood pressure is too low, some cells may be missing out on blood. Okay? So That's why it's important to understand blood pressure. So can you see here, when the blood is coming straight out of your heart, it's actually coming out at a higher pressure, and then it kind of loses pressure as it comes down or further and further away from the heart. Yeah? Because the heart is the pumping and it's creating that blood pressure. But as you go further along, you kind of lose it. All right, so we understand pressure, we understand blood flow and perfusion. What we're going to look at now is peripheral resistance, because there are two factors that affect blood flow. The difference in pressure between 2 points, and the other one is peripheral resistance. So the difference in pressure between 2 points, it's all about what the blood is doing. Peripheral resistance, it's all about the blood vessel, what impact it has on blood flow. So this is the impact of the blood itself, and this is the impact of the blood vessel. And they all work together to create blood flow. So this is the blood vessels impacting on the blood. How does that work? Well, peripheral resistance is affected or influenced by these three factors. Here we go. So the length of the blood vessel. The blood vessel length, okay, is directly proportional to its resistance. So if you have a look at this particular image, Q means flow. So what can we tell from this image? We can tell that the longer the blood vessel, the more resistance, and the lower the flow. Okay? So just get your head around these basic kind of concepts. So the length of the blood vessel is important. Let's have a look at the diameter of the blood vessel. Now let's have a bit of a think about this. If my blood vessel is really wide, okay, it's going to increase my flow. So increased diameter equals increasing flow. Okay? So just have a bit of a think about the diameter of the blood vessel. Increasing in diameter equals more blood flow. Let's have a look at this. Remember, we saw this when we looked at adrenaline. What is vasoconstriction? That is narrowing of the blood vessel. What is vasodilation? That is widening of the blood vessel. And we do that by manipulating that smooth muscle. Let's have a look at this video. See if I can play it. Here we go. It shows you vasodilation. Here we go. Let's have a look. Look at this. Look at vasodilation. So what you're doing is that you're increasing blood flow to the area. Look at that. Wow. See? Nothing happened, and then look at all the blood in there. Wow, that's vasodilation. Woo! Look at that. There we go. Okay, so we looked at two factors that affect peripheral resistance. And now let's look at the viscosity of the blood. Of course, we've seen this before. Okay, so high viscosity equals less blood flow. I don't need to go into that anymore. You've seen this before. Okay, and that is it. But before we finish off this section, I just want you to have a look at this picture for a minute. Let's have a look at the blood flow velocity. Here we have an artery. Then we have the capillary bed, and then we have the vein. Let's have a look at the velocity of blood. Can you see how it's fast, then slow, then fast again, but not as fast as it was before? That's interesting, isn't it? And look at the surface area. Low, super high at the capillary end, and then comes back down again. So just something to kind of, think about. Okay, all done.